الرجيم. بسم الله الرحمن الرحيم، وأصلي وأسلم على أشرف الله محمد بن عبد الله وعلى آله. السلام عليكم ورحمة الله. Today, inshallah, I will present the imaging of the female reproductive system, in which, inshallah, we are going to explain the different imaging modalities that commonly involved in assessment of this system and the normal appearance of the female organs, reproductive organs in this system. And then, inshallah, we are we discuss many abnormalities in this. So, to the imaging modalities that commonly performed for assessment of the female reproductive system, the commonest one is ultrasound. Ultrasound is the commonest imaging modalities and techniques that used for assessment of the female reproductive system. And then the other modalities such as plain X-ray, which is limitedly used, and fluoroscopic technique. Also, it is very important, especially in performing hysterosalpingogram, CT scan, MRI, also common sometimes will be used, and angiography for assessment of the blood vessels, uterine, the blood vessel female reproductive system, uterine anomalies, and pelvic organs, blood vessels. All of you know that the female reproductive system consists of uterus in the center, in the pelvic area, and the uterus connected laterally through the fallopian tubes to the ovaries. And the uterus consists of body and the cervix and the fundus, and there are 3 layers of the uterus: endometrium, myometrium, and on the ovaries lies in both sides, as we mentioned, connected to by fallopian tube. The first imaging modality is ultrasound. Ultrasound for assessment of the female reproductive system may be done by 2 techniques. The first one called transabdominal ultrasound. In transabdominal ultrasound, the operator put the probes or transducer on the anterior abdominal wall externally to look for the pelvic organ, to assess the uterus and the ovaries and the adnexia and the urea bladder. And if you look, the sonographer look to the monitor to assess the female reproductive system, the pelvic organs. This technique required full bladder. If you look to the monitor, also you can see the bladder is full of urine. This is very important preparation that should be done. Why? Because this full bladder used as acoustic window through which you can visualize the pelvic organ. Unless this urea bladder is full of urine, you are not able to see the pelvic organ. So before during a transabdominal ultrasound, the femur should be full bladder. To use this full bladder as a window, acoustic window, to look through it to the pelvic organ. The other technique is called transvaginal. This required administration of this probe, special designated probe. This probe inserted through the vagina, or also to look to the pelvic organ, female pelvic organ. You can see the uterus and the ovaries and adnexia. And in this technique, the bladder should be empty. Or sometimes we can, we need sometimes small amount of urine, because this used as a landmark to know the structure. Yeah. But in contrast, in the trans-abdominal, the urinary bladder should be full. The image in the transvaginal ultrasound, the quality of the image is better than in transabdominal. You can see the more details with, more resolution than in transabdominal ultrasound. So many conditions may be discovered with transvaginal ultrasound and cannot be displayed by the abdominal. So transvaginal ultrasound imaging quality is better than the trans-abdominal image. So this is what is this technique? Is it trans-abdominal ultrasound or transvaginal ultrasound? This one.
Transvaginal.
Why transvaginal and not trans-abdominal?
Abdominal.
Why trans-abdominal? To answer this, you can look to the urea bladder. This is a urine within the urea bladder. Urine is appear as anechoic, totally black, anechoic in the ultrasound. So this urine in the urea bladder used as a window to look to the uterus. This is the uterus in longitudinal or sagittal section. This is the fundus, and this is the body, and this is the cervix, and this is the vagina, and this is the endometrium stripe, which is echogenic, hyperechoic in the center. And so this is the myometrium, and this is the myometrium. In between the echogenic line is the endometrium. So this is trans-abdominal ultrasound. And you can see the anatomy in this picture. You can see the explanation of the anatomy. اللي هو زي ما قلنا ايش endometrium. Look to the endometrium, which is hyperechoic, totally bright in the center, and this is the myometrium, and this is also myometrium. This is the fundus body, cervix, uterine cervix, and this is urea bladder full of bladder. This is the longitudinal scan. In transverse section also required full bladder. This is urea bladder full of urine, and this is the uterus in the center. On the either side, the right side and the left side, there are ovaries. This is the right ovary, and this is the left ovary. And in between the myometrium in the center, there is a hyperechoic line, which is endometrium. So endometrium appear as echogenic linear stripe or hyperechoic linear stripe. Echogenic or hyperechoic linear stripe. But the myometrium is of low level of echoes, يعني less hypoechoic. This is a myometrium, and this is a myometrium. In vaginal ultrasound, the bladder is empty, so you are not able to see the urea bladder. يعني urea bladder because there is no urine to do this transvaginal ultrasound. So this is transvaginal ultrasound. Also, you can see the uterus. This is the fundus. أعلى المنطقة the fundus, and in the gunnar age there is the endometrium in the center, which is hyperechoic, and the myometrium in between in the superior or inferior to the endometrium. يعني endometrium بيكون in the middle. This endometrium, and don't miss, this is endometrium normally is hyperechoic in ultrasound of linear echogenic or hyperechoic. And this endometrial thickness should be measured, especially in the patient present with bleeding, especially in postmenopausal women, to exclude, endometrial carcinoma. لأنه this endometrial thickening, if it is more than 5 millimeter, it considered, enlarged. يعني up to 5 millimeter is normal. More than 5 millimeter is considered, abnormal. And in this time, you can suspect the endometrial carcinoma, especially in postmenopausal women. But endometrial hyperplasia is the common cause of this, vaginal bleeding in postmenopausal. لكن إذا كان عندنا patient postmenopause present with vaginal bleeding, you have to assess to exclude endometrial carcinoma by measuring the endometrial thickening, and also to assess the shape of the endometrium, is it regular or other or irregular. But sometimes you can do biopsy or DIC curettage to assessment or to exclusion endometrial carcinoma. So the normal endometrial thickening is up to 5 millimeter in postmenopausal. The normal ovaries, you have to notice the normal ovaries, which is on both sides. There are ovary, left ovary and right ovary. This normal ovary بيكون عندها شنو follicles. This follicles is very small and arranged in the peripheral. This is the normal appearance of the ovary. The central stroma is hyperechoic with a small ovary, with a small follicles. With small follicles that لاحظوا الفوليكل بتكون شنو anechoic. Anechoic follicles. This is very small, usually range between 2 to 3 to 4 millimeter. 3 to 4 millimeter. طيب عندنا تعرف البريجنسي. طيب what are the signs or what are the symptoms of the pregnancy؟ يعني the clinical presentation of pregnancy. يعني patient بتجي complain of what, or what are the symptoms of the pregnancy?
Maybe nausea.
Yeah, nausea, yes.
Delay in her menstrual cycle.
Yes, so this is called amenorrhea. Delay of the menstrual cycle or amenorrhea is the first sign. يعني usually this patient present complaining of amenorrhea, delayed or absence of cycle, and also this may be associated with nausea and vomiting. and late طبعا إذا جات late بتكون تجي abdominal swelling، يعني تكون abdominal swelling. لكن the cardinal presenting feature is amenorrhea. طيب if the patient present with amenorrhea in early pregnancy, طيب you have to do طبعا laboratory and imaging examination to confirm or to exclude pregnancy. So طبعا هنعمل لها ال HCG من السيرم or urine. This is in laboratory. But in the regarding the imaging, what is the appropriate image technique that used for confirmation or exclusion of pregnancy?
Ultrasound.
هنعمل التراساوند. طيب احنا زي ما قلنا عندنا اتفقنا ان عندنا two techniques, transvaginal and transabdominal. Transvaginal is very sensitive, can detect the pregnancy more earlier than the transabdominal. So you can see the first sign of pregnancy. First sign of pregnancy is presence of this sac, which is called gestational sac. اللي هي زي السيست كده، اللي هي دي gestational sac, which is the first signs of pregnancy that can be seen by ultrasound, presence of gestational sac. So this gestational sac can be seen by transvaginal ultrasound at 4 to 5 weeks, and by transabdominal ultrasound it can be seen around 6 weeks. So by transvaginal ultrasound you can detect this cyst اللي هي قلنا اسمها ايه gestational sac area. طيب if you look carefully within the gestational sac there is other cyst. This is called yolk sac. The yolk sac then form within the gestational sac. So this is gestational sac and the smaller one is the yolk sac. And if you look also you can see there is a echoes here. This is the embryo. So this is the cyst, gestational sac, and this is the yolk sac, and this is the embryo. This is the embryo. So this is a obstetric ultrasound in the early pregnancy demonstrates the gestational sac, yolk sac, and the embryo. And if you put a Doppler color ultrasound, you can see the heart beating in this, early pregnancy. So the gestational sac appear as a ring, echogenic ring. لاحظ انها ring لكن فيها echogenic ring. This is a hyperechoic or echogenic ring with anechoic center. السنتر بتاعتها anechoic. This is a anechoic center with echogenic ring. This is a. طيب to assess طبعا مهم جدا to assess شنو الجستيشنال age يعني عمر الجنين gestational age. But this is done in this stage by measuring the mean sac diameter. بنعمل transverse and longitudinal 3-dimension which length and height of the gestational sac, and we calculate the mean of this can be calculated in days or weeks يعني by the machine. يعني انت ما عليك الا تعمل measuring in the width and length and height, and then the machine, the ultrasound machine, calculate or this mean sac diameter into weeks. هتقول لك مثلا this is a 5 weeks pregnancy, 6 weeks according to the length of this measure. طيب عرفنا انه this is the early signs of pregnancy. طيب then the fetus will be increase in size and يحصل له cross. Then in this time you can see this fetus like this. قبل كده احنا اول شيء عندنا انه ultrasound findings in normal pregnancy يعني in intrauterine pregnancy at 5 to 6 week gestational age gestational sac and yolk sac are visible in the uterus زي ما وضحنا. This is the gestational sac and this yolk sac should be visible at 5 to 6 weeks. طيب إذا كان البيشنت هي suspected pregnancy مثلا depending on the clinical presentation and laboratory finding and the gestational sac and even the yolk sac cannot be seen in this patient, you should diagnose this patient as pregnancy of unknown location. يعني انه في pregnancy لكن not seen. It could be in ectopic areas يعني. فإذا any patient highly suspected of pregnancy by clinical presentation and laboratory findings without gestational sac زي دي, this should be classified as pregnancy of unknown location. طيب قلنا بعد الجستيشنال sac بعد ذاك اللحظة الامبريو ده بيحصل له جروس فبيزيد زي دي كده. في اللحظة دي نحن ما بنعمل assessment of for the gestational age by this method. عندنا method أخرى. This is called crown rump length. This is done by measuring the full length from the top of the head to the bottom أو اللي هي the buttock يعني. Measuring this full length, also the machine calculates this measurement and give us the gestational age in 2 weeks. يعني هنعمل measurement from the buttock to the top of the head, and the machine calculates this into weeks. هتقول لك مثلا this is a 9 weeks gestational age. عمر الجنين 9 weeks. But this is called crown rump length, in which you can see more details of the fetus. You can see the head, the mouth, chest and the abdomen and the lower limbs and the spine and the posterior. So this is called crown rumblings. Crown rumbling. طيب بعدها بيحصل more gross. In this time you can assess the gestational age. نحن مهمنا طبعا جدا نعرف انه الجستيشنال age الجنين ده عمره كم في within the uterus intrauterine حصل له gross ولا not. ف you can assess the gestational age by this other methods اللي هي يسموها انه parietal diameter. Also you can measure the head from the outer table to inner table. بنعمل measuring from here to here through the salami. This is salami, and this also measurement calculated into weeks by gestational by the machine. And also بتعمل لك تديك measure تقول لك انه this pregnancy مثلا 29 weeks according to 5 parietal diameter. 5 parietal diameter. Next to this برضه بيحصل increase or growth of the fetus. You can assess the gestational sac, especially in the second and third trimester, or in the late one is by the femur length. So this is the femur of the fetus. Femur of the fetus. You can also measure the full length of the femur, and also the machine calculate this and give this measurement into weeks. أقول لك إنه this is the 34 weeks gestational age. لاحظ إنه دي يستخدم lazy in the second and third trimester. طيب the earliest gestational age measure is the more accurate. So لكن the most accurate one is the is crown rump. يعني إذا البيشنت مثلا كانت uncertain of her date يعني she does not know when her last menstrual period, we depend on this one, the crown rumblings. The crown rumblings is the more accurate imaging technique in calculation of the gestational age of the fetus. طيب also this التراساوند كلها التراساوند طبعا you can see the يعني well organized fetus, you can see the upper limbs يعني حتى even you can see the humerus and the يعني arm and forearm and the head, the mouth, the lower limbs and the spine and the chest and the ribs. These are the ribs, and also this is the fetus in the uterine pregnancy. You can see the spine, and you can see the lower limbs, the thorax of the patient and the abdomen, and this is amniotic fluid. This is the fluid. فthis is عندنا التكنيك اسمه fetal well being assessment اللي هو biophysical profile. فدي مثلا البيشنت بنعمل اذا البيشنت كان مثلا fetal distress or for the follow up of the intrauterine pregnancy. This can be done by measuring the amniotic fluid. بنعمل measuring for the amniotic fluid, the volume of the fluid, amniotic fluid, and also هي done تقريبا in half an hour. And also you can look and see the movement of the body in حصل movement of the مثلا upper and lower limbs, and also you can assess the flexion of the limbs in حصل flexion and extension in this in a specific time, and you can see the assess the respiratory rate. كل واحدة عندها زي point, and then we the summation of this point بنعمل إنه نقول إنه this is مثلا this pregnancy this fetus is يعني not in distress or according to the point. فده بسموه biophysical profile يعني اللي هو can be done by assessing of these points, the amniotic fluid, the movement of the body and flexion and extension of the limbs, upper and lower limbs, and measuring of the respiratory system. طيب نحن عارفين message of contraceptive اللي هو الفاميلي بلاننج. One of these is contraceptive device, intrauterine device, intrauterine contraceptive device or intrauterine device. IUCD or sometimes بيكتبوها IUD, intrauterine device. And this عارفين one of the complication of this IUCD عندها many complication PID مثلا اللي هو الانفكشن يعني ممكن تعمل لك bleeding vaginal bleeding. Although this now يعني بقت ما common يعني. And sometimes can be complicated by perforation of the uterus. يعني it can be لكن it is not common يعني. ف if this IUCD perforates the uterus, you have to search for this IUCD. Why this IUCD is present? If this IUCD is lost, it should be investigated. This usually done by ultrasound. يعني you have to search for this IUCD by ultrasound. احنا عارفين ال IUCD بيكون عنده زي تي شيب كده، والالتراساوند بيكون هايبريكويد يعني ابيض هايبريكويد with characteristic shape اللي هو بيكون شنو؟ تي شيب. فاذا this IUCD appear on the ultrasound as the hypericonic structure or highly reflective structure. And طبعا اذا كان نورمال بيكون in the uterine cavity، لكن اذا حصل له perforate if it perforates the uterus بيكون outside of the uterus. طيب المهم احنا to search for this IUCD in case of perforated uterus. طيب if you fail in localization of this IUCD, what is the next option? In this time you can do شنو؟ plain abdominal X-ray for the abdomen. نعمل plain X-ray يعني to search for this migrated device through the uterus. فthis is مثلا plain abdominal X-ray. This is a normal position of the IUCD in the place. لكن إذا كان البيشنت هي مثلا احنا يعني suspected perforated IUD بنعمل abdominal ultrasound. If you find it الحمد لله. If not, you can do plain abdominal X-ray. You can see this IUD in the يعني ectopic area. It can be seen in the مثلا abdomen, not in the pelvis, within the يعني not in place يعني. If it perforates the uterus. So the next option is IUCD. طيب عندنا النكست تكنيك ده طبعا كلكم كان اعطيناكم له زمان اللي هو الهيستروسالبنجيوجرام. هيستروسالبنجيوجرافي زي ما اتكلمنا المره اللي فاتت عنه في in the reproductive system block. This is an imaging technique done by injection of contrast. This contrast injected into the cervical canal, and then we take a serial radiograph. This technique done for assessment of the uterine cavity, يعني to look for the morphology of the uterine cavity, and also for assessment of the fallopian tubes. Are they patent or not? يعني is it blocked or not? This is a hysterosalpingogram. لاحظوا محتاجين فوق contrast and بعد نحن serial radiograph can be done by fluoroscopy usually or can be done by يعني شنو conventional technique. طيب the patient should be in the isotomy position. بعد ذاك under aseptic condition we insert a cannula. This cannula put in the cervical canal. يعني we put the cannula in the cervical canal and then we inject the contrast. The contrast fills the uterine cavity. Then normal احنا عارفين the uterine cavity connected to the fallopian tube bilaterally. لذلك الكونتراست بعد ذاك هيمشي فين؟ هيمشي إلى fallopian tubes. طيب احنا عارفون lateral or lateral part of the fallopian tubes are open freely in the in the uterine cavity. طيب إذا هي normal or patent fallopian tube نتوقع إنه this contrast filling the uterine cavity. If it block, this is other this is considered abnormal ودي قضية أخرى. لكن normally باش نخليه ليزوتوم position بنعطي contrast. We put a tube or catheter in the external uterine os, and then we inject the contrast filling the uterine cavity, and then the uterine and the fallopian tubes. In normal patient, the contrast spill into the peritoneal cavity. If not, this is indicating a blockage tubes. طيب the indication must indicate the commonest one the commonest indication is infertility. يعني the patient present with infertility, this technique done for assessment of the blockage of the fallopian tube or not. لأنه ما هيحصل fertilization if this tube is blocked. فلذلك you have to assess the patency of the fallopian tube. And also in case of recurrent miscarriages or the congenital uterine anomalies, as we will explain, and there are many congenital anomalies and many uterine tube اللي هي adhesions ورا مثلا كان عندنا حتى to assess the مثلا بيشن عملنا لها ligation to assess the tubes for يعني proper ligation or not. The contraindication if there is a recent surgery on the tubes. يعني the patient كان عنده recent surgery of tubes is contraindicated. يعني you have to wait. And also in case of severe infection, acute pelvic inflammatory disease in the uterus or in the يعني in the upper part of the reproductive system. And contrast allergy it is not common, لكن it will be contraindicated but not absolute relatively. يعني لأنه ما قاعد يحصل شنو contrast allergy common in this technique. طيب the last one is very important. If there is any suspicion of pregnancy, don't do this لأنه هي hazardous for the يعني radiation contrast. So if you are not certain about the pregnancy or not, you can investigate the patient by urine pregnancy test or beta HCG. نعمل سيرم مثلا HCG and you يعني لذلك you have to be sure that this patient is not pregnant before doing this technique. Complication not common but could be pain. This pain is usually mild and sometimes there is no pain. Bleeding most also it is not common, minimal bleeding or not. Infection may be occurred later. Contrast media reaction very rare. This is suspected complication although they are not common. طيب اتفقنا انه البيشن بنعمل catheter in the external uterine os. This is the first one and we inject the contrast. لاحظوا الكونتراست بيعبي وين؟ the uterine cavity. This is the contrast البلاك دي. ليش هنا بلاك؟ لانه الصوره دي ماخوذه من المونيتور يعني. This is the reverse image. فبعد ذاك الكونتراست نورمال بيمشي فين؟ بيمشي على اليوتراين تيوبس in the uterine tubes. بعد ذاك if the يعني uterine tubes طبعا هي قلنا in the lateral ends بتكون هي شنو؟ open. يعني المفروض الكونتراست بعد ذاك شنو؟ to spill into uterine cavity يتدفق على اليوتراين cavity in normal. لكن إذا كان في blockage in any point طبعا الكونتراست ما حيمر يعني حيكون مسكر هنا. فإذا ما حيحصل لنا شنو spill لن يتدفق الكونتراست in the uterine cavity. فذيس يعني الآن دي normal technique. لاحظوا الكونتراست أول عبى وين؟ enhance the uterine cavity then the fallopian tubes. طيب also this is a normal HCSG. لاحظوا هنا دي شنو؟ this is the catheter اللي هي عندك external uterine اللي هي cannula يعني external uterine os. then we inject the contrast. طبعا الكانيولا دي connected to the syringe. السيرنج فيها الكونتراست. بنحط الكونتراست we push the contrast to fill the شنو the uterine cavity then the contrast go through the شنو the tube. لاحظوا بعد ذاك الكونتراست متدفق كثير in the uterine cavity. this is the contrast لأنه معناته حصل شنو free spill يعني this is a normal. الكونتراست ده بعد ما أنت تعبي اليوترس يمشي الفالوبيان تيوبس. إذا ما في أي بلوكيج بعد ده ما في له ما هو قلنا الديستال هي فاتحة. This contrast is still into the uterine cavity. This is a normal. Also this is a uterus with contrast يعني normal specified uterine cavity with contrast and you can see the uterine tubes in both sides uterine tube with spills. يعني عندنا حصل شنو تدفق للكونتراست free spill in the uterine cavity. But in this one you can see the contrast occupying the uterine cavity and if you follow the left fallopian tube you can see it is normal but in this part there is no spill أول شيء ما في contrast متدفق in the uterine cavity and also you can see there is a the left one is dilated. لو لاحظتوا الكندلة هنا ده كان الدايمتر بتاع التيوب يعني like this. لكن in this one the fallopian tube is dilated. حصل لها توسع. ليش؟ because there is a blockage هنا. ما في مجال يتدفق الكونترات، فلذلك ما في طريقة إلا يحصل لها شنو dilatation. ده بسموه شنو hydrosalpingo. dilated شنو fallopian tube hydrosalpingo. Also in the other part there is a distal blockage in the right one. Also there is a شنو hydrosalpingo dilated fallopian tube. So there is a bilateral hydrosalpingo with bilateral distal blockage of the uterine tube. طيب CT also can be used for assessment of the اتكلمنا عن plain X-ray والultrasound والhysterosalpingogram. CT can be used, and this is a normal appearance of the CT at the level of the pelvic, and you can see the uterus. طبعا the normal position of the uterus is between the urinary bladder and the rectum. The rectum is posterior to the uterus, and the urinary bladder is anterior. This is the uterus, this is the urea bladder, and this is the rectum. And this is the uterus. On the both sides, the ovaries also may be seen. Ovaries, left ovaries and right ovaries. This is the normal appearance of the uterus in CT. This is CT. You can see the bone is very dense. MRI also can be used in many conditions or abnormalities to assess many abnormalities. This is MRI. Also, this is the sagittal MRI. This is the urinary bladder, and this is the uterus. طبعا sagittal لذلك. What is this? What is this part? كله ده ايش هو؟ What is this? What is this type? What is this structure? طيب what is this?
Sacrum.
Yes? Yes? Martha?
This is the sacrum.
This is the sacrum, yes. What's your name? Sorry.
A.rahman.
Yeah, this is the يعني this is the spine, this is the lumbar spine, and this is the sacrum, and this is the coccyx. And what is this?
Uterus.
This is the uterus. Yes, this is the uterus. And what is this?
Urinary bladder.
Urinary bladder. What is this part of the uterus? This one.
Maybe endometrium.
Yes, this is endometrium. So what is the normal appearance of endometrium in this? What is this MRI sequence?
MRI.
MRI sequence تكلمنا عنها. يعني ايش السيكونس of MRI? What are the sequence do you know?
T2.
Yeah, this is
T2.
T2. Why T2? How to know this is a T2? احنا قلنا T2 characterized by
Intense hyaline.
yes, it's the hyper intense fluid. The fluid دايما بيكون hyper intense pride. But this is the urine. So this is a T2. So what is the normal appearance of endometrium in T2 MRI? This is endometrium. How appear this endometrium? يعني the signal intensity of this endometrium.
Highly signal intensity.
Yes, this is the hyper intense or high signal intensity. High signal, so the normal endometrium in T2 appear as hyper intense or of high signal in this T2. So now we're going to talk about the congenital anomalies of the uterus, and this may be a cause of infertility, and the patient with infertility you have to exclude the congenital anomalies of the uterus. زي ما قلنا برضه you have to exclude the blockage of the uterine cavity. The first condition is called acute uterus, which is characterized by لاحظ انه حصل شنو indentation of the endometrium. there is an indentation in the fundus characterized by indentation. حصل له شنو كأنه compress downward. This is a indentation of the endometrium as the uterine fundus. حصل شنو compress. this is a hysterosalpingogram. لاحظ انه this is a hysterosalpingogram. what is this?
uterine tube.
uterine tube. طيب is it normal this uterine tube or not?
It is obstructed.
why obstructed? نحن قلنا lateral ends of the uterine tubes normally بتكون مالها تكون normal هي open يعني هي normally هي distal part بتكون فتحة يعني open. so the contrast can pass through the uterine tubes and then لأنه هي open not blindly ended يعني ما مسكرة. if you see the contrast متدفق يعني in the uterine cavity this indicates إنه this is normal uterine tube. لكن إذا ما لقيت الكونتراست متدفق معناته إنه this is a uterine tube is blocked. so in this case you can see there is a free spill. بيسموه free spill يعني تدفق الكونتراست بحرية تامة. free spill of contrast. this indicates إنه this fallopian tube or uterine tube is patent. and the other one also you can see there is a spill of contrast. so the uterine cavity is normally ossified by contrast. there is no filling defect يعني ما كل المنطقة حصلت show ossification by contrast but there is بيسموه subtle shape indentation of the uterine fundus. there is a compressor indentation of the uterine fundus. this is called arcuate uterus. the second congenital anomaly is septate uterus in which there is a عندنا two horns. also this is the left fallopian tube and this is the right fallopian tube. this is the right horn and this is the left horn. between the two horns there is a angle. لاحظ إن عندنا angle in this one. this angle is acute angle يعني حادة زاوية حادة angle usually less than 75 degree. so in septate uterus there is a double horns or duplication. we see here duplication anomaly characterized by presence of two horns. لكن أهم شيء the angle between the two horns is acute usually less than 75 degree. this is called septate uterus. لاحظ إنه الانجل إيش acute less than 75. in the other one is bicornuate uterus. in bicornuate uterus also there is a two horns يعني this one and this one but the angle between the two horns is obtuse angle يعني زاوية منفرية يعني كبيرة. لاحظ إنه obtuse angle. this is يعني the main difference between the bicornuate uterus and septate uterus. in septate uterus the angle is acute usually less than 75 and in bicornuate the angle between the two horns of uterine or usually more than 105. 105 the angle between the two horns. also this is a hysterosalpingogram. don't miss this example. hysterosalpingogram. طيب تعال عندنا حاجه اسمها يونيكورنيات. من اسمه ما عندنا شنو two horns. عندنا only one horn. this is a result from failure of Mullerian duct to elongate and the other one is develop normal. واحدة حصل لها failure. the other horn is normally develop. you can see there is only one horn. this is usually appear as the fusiform with tapering end. الاpex بتاعتها بيحصل لها يعني هي fusiform appearance. the upper part منها بيكون بيحصل لها tapering تبقى اقل حجما. ولاحظ انها connected fallopian tubes او uterine tubes. هي there is a fallopian tube connected to this horn. and usually in this case you can see the يعني هي ما بتكون off center. This horse يعني بتكون either on the right or left، ما بتكون centralized. فلاحظ ان هنا مثلا off center shifted يعني from the midline, not in the midline. This single horn or unicorniate uterus. طيب طبعا هو بنعمل هيسترو سالبنجيوجرام، لكن MRI تقريبا هي الان ذي يعني بقت هي المور يعني تكنيك and more sensitive and more reliable technique and assessment of or on the congenital anomaly. So this is MRI. You can see the two horns and you can see the angles between the two horns which is obtuse. الانجل كبيرة شوية، لكن in this one the angle is acute. But this is septate. نحن قلنا in septate angle and the septate uterus the two horns, the angle between the two horns is acute, usually less than 75. But in the bicornuate the angle is broad, obtuse. اللي هي زي ما بيسموها مفرية more than 105. Also CT can be used for demonstration of the uterine anomalies, but this is the bicornuate uterus. This is the first horn and this is the second horn, and you can see the angle also. لكن طبعا الانجل اللي تكون في غالبا تكون في في الكرونري يعني تكون اوضح، لكن in the axial احيانا ما بتكون more clear. المهم this is the two horns, but this is the bicornuate uterus and this is the MRI. واضح هنا this is MRI لكن coronal you can see the septate uterus. There is a two horns اللي هو دي septate angle, but this is the MRI demonstrates the septate uterus. طيب what is this examination or this technique? The CT, ultrasound, what is this? الشكل ده يذكرك ب which technique؟ Yes. This is hysterosalpingogram. Yes, hysterosalpingogram. طيب please comment this or report this one. How to report this? يعني what do you see?
There is a blockage.
Yes. In which side?
Proximal tubule.
Yes. How about the uterus? حاسس إن هو شيء دي التيوب اللي هي put to push the contrast. The uterus is normally obfuscated by the contrast. يعني ما في منطقة سوداء، كلها حصل contrast obfuscation. يعني كلها أخذت الكونتراست. لكن there is no obfuscation of the uterine tubes. ما في أي uterine tube حتى هنا in the proximal part blockage. يعني there is no contrast in the tube even in the proximal part. So this is a bilateral blockage, tuber blockage, uterine tuber blockage. And in this one, you can see the contrast within the uterus, normal specified uterine cavity by contrast, no filling defect with normal uterine cavity configuration. You can see the proximal part of the fallopian tube. And in the distal one, it is dilated. حتى ما فيش there is no what قلنا بنسمي ايش there is no what in this side. ممكن من the ospin نجيب لكم زي ده نقول لك comment or on this. إذا تعرف إن how to comment on this hysterosalpingogram. إن there is no قلنا the term usually used is there is no spell of contrast into the uterine cavity. يعني ما في تدفق. There is no spell and there is a hydrosalpingo dilated distal uterine tube. Also in the right side يعني نلاحظوا اليوتراين تيوب هنا نورمال، لكن هنا حصل لها دايليتيشن. ليش؟ لأنها هي بلوكج in the distal part، ما قادر الكونتراست باس، فما عنده مجال غير إنه يحصل دايليتيشن of the distal uterine tube. This is also hydrosalpingo، يسموها hydrosalpingo without or with no evidence of peritoneal spell of contrast. And also this is a HSD. There are bilateral hydrosalpingo، يعني كل الفالوبيان تيوبس both side dilated. المفروض نورمال تكون زي دي كده، بس هي dilated without peritoneal spill، يعني معناتها عندنا شنو distal blockage، حصل blockage هنا، فدي is distal tube. And also this is a HSD hysterosalpingogram. The right fallopian tube is blocked at this point, and there is no, peritoneal spill of contrast. There is no intrauterine peritoneal cavity spill of contrast. And also this is the other fallopian tube is dilated, at the grossly dilated، بقت متوسعة، معناتها هي شنو blockage. And there is no free spill of contrast، ما في تدفق للcontrast. This is hydrosalpingo. There is a term used for description of dilated tube يسميها hydrosalpingo. This hydrosalpingo can be demonstrated by ultrasound. So this is a dilated fallopian tube. And also this fallopian tube dilatation can be seen by MRI. So this is MRI. You can see the hydrosalpingo dilated uterine tube. Dilated fluid, uterine tube حاصل لها يوجد hyper intensity. This is a fluid intensity. This is a fluid intensity in this T2 MRI axial pelvis. طيب أنا أتكلم عن very important condition polycystic ovarian syndrome. طبعا احنا عارفين ككلينيكال برزنتيشن البيشنت بتجي انها ممكن تكون irregular cycle, and usually the patient present with acne, obesity, and إذا كانت married infertility and hirsutism. Hirsutism is presence of hair in abnormal position like a male، يعني ممكن نلقى in the مثلا above the lips ولا في in abnormal distribution of the hair، يعني كأنها في male areas distribution. hirsutism, obesity. This is a clinical presentation. To diagnose this radiologically we do ultrasound, especially transvaginal, which is more sensitive than trans abdominal. You have to to diagnose this, there should be 10 or more cysts. يعني you have to find more or 10 or more cysts, and the ovaries should be large bulky. يعني إذا to diagnose or to put this diagnosis أول شيء إن الأوفرز يكون large with 10 or more cysts. ف this is transvaginal ultrasound. لاحظ إنه transvaginal there is no urinary bladder full of urine. But there are multiple cysts located periphery in the ovary. لاحظوا الأوفري ذاته large bulky ovary. السنترال ستروما بتكون ايكوجينيك، السنترال ايكوجينيك ستروما. فذيس ده إذا عندنا multiple cysts نحسبه نلقاهم should be 10 or more، بيكون السايز بتاعه ذاته أكبر من النورمال فوليكلز. يعني النورمال فوليكلز كانت اتفقنا تكون 3 to 4 ملم، دي تكون more than الفوليكلز. أهم شيء located periphery بيسموها السترينج اوف بيرال، string of spiral sign. This is a feature of polycystic ovary. This is polycystic ovary by ultrasound, and also polycystic ovary by ultrasound, and this is polycystic ovary by MRI. You can see the left uterus. لاحظ انه الcyst located periphery بيكون hyper intense. عندنا multiple cysts in the left ovary This is the uterus, and this is the left ovary. So the typical feature of polycystic ovary on ultrasound or MRI يكون عندنا أول شيء الأوفري should be bulky large ovary. ثاني عندنا المالتيبل سيست دي بتكون peripherally located. قلنا عندنا characteristic feature اللي هي string of growth appearance. فthis is the features of polycystic. طيب نتكلم عن اليوتراين لايومايوما or fibroid. هي طبعا هي most common benign tumor. تقريبا about 70% of patient ممكن هي الموجودة تقريبا 70% of patient وهي usually discovered incidentally و usually of no clinical significant. يعني دائما البيشنت ما يكون عنده symptoms. حتى إذا كان البيشنت عنده مثلا symptoms مثلا vaginal bleeding, don't put this as a cause of this vaginal bleeding. You have to exclude others. For usually the patient is asymptomatic and sometimes may be present with excessive menorrhagia, or it can be cause of infertility if it is in the subserous areas مثلا. And if it is quite large, it can cause abortion. It can be miscarriage يعني. And also it can be a cause of postpartum hemorrhage. And sometimes it may be present with the palpable mass. So to diagnose this leiomyoma or fibroid, the most appropriate initial test for this patient ultrasound is the appropriate initial imaging technique, especially the transvaginal. طيب how to diagnose this uterine fibroid? What is the features of uterine fibroid؟ نحن قلنا هي common و usually find incidentally يعني. فبيكون عندنا well circumscribed hypoechoic mass, solid mass, not cystic mass. This uterine fibroid commonly demonstrates calcification. لذلك بنلقى كثير إن فيها calcification. زي ما تتذكروا كان تكلمنا one of the cause of the calcified abdominal X-ray one is the uterine fibroid. أو أحيانا نلقى cystic area within the mass يعني due to degeneration of this tumor. أحيانا this الفايبرويد بتكون very يعني sizable يعني. It can cause a pressure on the kidney or in the ureter, causing hydronephrosis, يعني dilatation of the pelvic calyceus system. طيب X-ray and CT يعني not commonly يعني done for assessment of the uterine fibroid لأنه هو يعني not displayed by this imaging technique. لكن sometimes we can do MRI with or without contrast, and this can be done for more characterization of the leiomyoma, especially before the treatment. يعني إذا كان إحنا دايرين نعمل لها surgical or interventional procedure, MRI usually done for more characterization of this leiomyoma, and also can be used for exclusion of other causes or differential diagnosis. endometrioma or endometriosis والبوليبس والاشياء دي can be ruled out by this MRI. So this is normal زي ما شفتوا كان normal endometrial stripe and the myoma in the normal uterus ultrasound. But in this one there is abnormality. Anyone to describe the abnormality that illustrated in this image? How to describe this abnormality? What's yes.
Hypoechoic, it's darker
Yes.
than the surround.
Yeah, thank you. What about the shape? شكلها.
Circular shape, maybe.
Circular shape, yes. What about the site or position? Where do you see? This is endometrium, and احنا إذا ماشيين كده this is the lower part يعني this is the cervix. So what is this area? What is the position? يعني the upper part in the fundus. So as you mentioned, there is a well-defined hypoechoic lesion in the fundus of the uterus of circular or rounded shape. But this is, leiomyoma. What is this? An image. What is this image?
MRI.
And what is this?
MRI.
MRI. Which plane? This one. What is this section?
Is it coronal?
Look again. لاحظ إنه this is the back.
Axial.
Yeah, this is axial. And what is this section?
Sagittal.
Sagittal. طيب, in this axial you can see this lesion. This lesion. This is MRI axial. You can see this lesion. أول قالوا البيشنت ده هي 41-year-old female patient present with visible and palpable lower abdominal mass. وهي قلنا one of the presentation of the leiomyoma هي usually discovered incidentally يعني بالصدفة، لكن أحيانا the patient may present with palpable mass. This present with palpable mass and hyperenuria and pressure symptoms. يعني هي بتعمل لنا أحيانا pressure symptoms، بتحس إنه في شيء شنو عامل له pressure يعني لأنه هي large. You can see this lesion which is smooth with a smooth outline and well-defined smooth outline with the moderate signal intensity. يعني هي تقريبا يعني of يعني not hyperechoic or not hypoechoic. It is a moderate signal intensity in this area. But in the sagittal you can see this lesion هي الماس. This الماس لاحظ انه هنا two parts. The first one in the area of the cervix and the other one in the fundus. فدي الماس extending from here to here. A huge mass. And this is the كل الماس تبدأ من cervix and then at the fundus. This is the with heterogeneous appearance. ليش قلنا heterogeneous؟ لاحظوا هنا كان كل الكوجينيسيتي غالبا of similar intensity كلها بدرجه واحده من الابيرنس، لكن هنا في منطقه more bright more hyper intense مره بيسموها heterogeneous in intensity. Heterogeneous intensity. So this lesion is extending from the cervix up to the fundus. طيب what is this?
Rectum.
Yes, and what is this? Anterior to the uterus.
urinary bladder.
Yes, this is urinary bladder. So you can see this mass compressing this, the urinary bladder and the bowel يعني the posterior to the اللي هي rectum and anterior to the urinary bladder are compressed. يعني this is abnormal. لاحظ حصل لها compression by this huge mass. but this is leiomyoma. طيب البوليسيستيك انا السلايد دي المفروض تكون قبل دي لكن ما اعرف اجابتها كده. بوليسيستيك اوفري سندروم زي ما تكلمنا عنها انها هي characterized by enlarged ovary with multiple cysts. This is polycystic ovary syndrome, but in transvaginal ultrasound you can see the both ovaries are bulky with the anechoic cystic lesion arranged in the periphery with the اللي هي قلنا with the string of pearls appearance. So this is polycystic ovary syndrome. الفايبرويد زي ما قلنا بيحصل لها calcification. فاذا حصل لها calcification طبعا في الحاله دي انت بتقدر تشوفها بشنو اكس راي ولا سي تي، لانه زي ما قلنا انه السي تي والاكس راي دايما بيحبوا شنو اي حاجه فيها calcification. عكس الام ار اي. الام ار اي كالسيفيكيشن عنده معاه مشكله. فذيس از calcified uterine fibroid in this plain X-ray seen in the pelvic area with multiple irregular calcification. فthis is a calcified uterine fibroid. زي ما اتفقنا زمان إن one of the causes of calcification in the abdominal pelvis is calcified. Also dermoid tumor, but dermoid cyst also the common, especially in women 30 years and less. and this dermoid cyst عارفين الكومبوننت بتاعها في الباثولوجي انها هي بتتكون من الفات وكالسيفيكيشن اللي هي T shape appearance and soft tissue and hair. This is a component of this dermoid cyst. لذلك إذا عملنا imaging for this according to the component. This is plain X-ray you can see. طبعا أنت من plain X-ray يعني you can see the fat يعني sometimes you can see the fat and طبعا X-ray good imaging technique for calcification. The hair is not soft tissue, it could be seen gray لكن ما بيكون مبين كويس. فلذلك on the plain X-ray you can see the calcification اللي هي teeth. This is a teeth shape appearance in the pelvis. This is highly suggestive of dermoid tumor. This plain X-ray pelvis demonstrate this well-developed teeth within the cyst اللي هي this is dermoid cyst. This is CT طبعا, the urea bladder, and this is the uterus, and this is the rectum. You can see this cystic lesion. This is cystic lesion. This is لاحظوا إنه عندنا فيها calcification, and هنا فيها شنو؟ فيها fat, fat density, hypo, totally dark. فthis is dermoid cyst. فإذا المبين لنا هنا الCT طبعا calcification بيبين كويس, and you can see the fat اللي هي density of dermoid cyst, and this is the calcification. فthis is dermoid cyst on CT. طيب on ultrasound طبعا احنا أكثر حاجة بنعملها الالتراساوند to diagnose dermoid cyst. ف what are the normal or what are the sonographic feature of dermoid cyst؟ أول بيكون عندنا large tumor with solid component. This is a solid component. لاحظ إن دي cyst لكن this is a solid component. This is a cyst. حتى عندنا شنو posterior acoustic enhancement. the posterior قلنا دائما عشان نعرف إنها cyst إنه posterior acoustic enhancement المنطقة البيضاء خلف الcyst. and this is solid component. ويكون عندنا شنو calcification. this is the calcification. this is a feature of all dermoid cysts on ultrasound. أما هنا عندنا
دكتور.
mass. yes.
عندي سؤال.
yes.
الدرموتس هو نفس اللي يعطي فولس بوزيتيف بريجننسي تيست؟
لا ذاك قصدك الهايداتي فورمول. yes. molar pregnancy.
اللي طلع انه حامل بس هي مو حامل فولس
yes.
بوزيتيف.
molar pregnancy إن شاء الله هنتكلم عنه. molar pregnancy.
اوكي.
تمام. فذيس إذا أهم شيء إنه هنا اللارج شنو lesion or mass. أهم شيء الكومبوننت بتاعتها فيها solid part. This is a cystic and this is solid part and this is a calcification. يعني تتذكر بس الكومبوننت بتاعته بتعرف إنه this is شنو dermoid cyst. Also dermoid cyst can be demonstrated by MRI. أنت لما تعرف كل واحد من الكومبوننت appearance بتاعته في different image بتعرف. فthis is a cyst and you can see this calcification بيحصل لنا as the area of no signal بتكون totally black. this is a calcification. This is a calcification. This is the dermoid cyst on MRI. Dermoid cyst on MRI. طيب what is this imaging technique or
MRI.
MRI.
explain.
Sagittal.
Sagittal. طيب what is this?
Uterus.
And what is this?
urinary bladder.
And what is this?
Rectum.
Rectum. طيب if you look to this area you can see there is a lesion here in the cervix. طبعا cervix there is a hyperintense lesion. Hyperintense, although it is small, but there is a hyperintense lesion. But this in this patient you have to exclude, CA cervix. And in the other one, also this is a MRI, زي ما شايفين T2. Also you can see this lesion. This lesion also in the cervix, طبعا cervix. This is the fundus, this is the endometrium and myometrium, and this is a cervical lesion adjacent to the rectum. فحتى احنا ذات اذا البيشنت عنده cervical carcinoma, you have to assess the invasion of the rectum or not, and sometimes invasion of the urinary bladder by this method. This is the cervical carcinoma of the cervix. طبعا هي it is a commonest malignancy. طيب ده نتكلم عن حاجة very important emergency ectopic pregnancy اللي هو يحصل لنا implantation of fertilized ovum outside the uterine cavity. احنا عارفين ال implantation usually occurs in the uterus, but this is a cystic اللي هي gestation itself. قلنا normally implanted in the uterine cavity, but sometimes there is implantation of the fertilized ovum outside the uterine cavity. It could be occurs in the fallopian tubes or in the abdominal cavity, and and in the not in the uterine cavity. طيب البيشنت usually present with amenorrhea لانه هو حصل اصلا في pregnancy، بس هو زي يعني بيكون عندنا amenorrhea، بيكون عنده delay of cycle. and عندنا التراياد، عندنا classical presentation بيكون البيشنت بيجي abdominal pain and vaginal bleeding and amenorrhea. This is the triad of the classic presentation of suspected ectopic pregnancy. If any patient present with this symptom, you have to exclude ectopic pregnancy لأنه fatal, especially if it rupture، لأنه بيحصل لها complication دائما by rupturing. زي ما قلنا common site of implantation of يعني abnormal in the fallopian tube، يعني يحصل implantation in the fallopian tube. So this is the common site of the implantation of يعني abnormal implantation of the pregnancy. Although it can be occurs in other part of abdominal or cervical region. طيب احنا عندنا risk factor، يعني دي برضه مهمة انه any patient مثلا عنده past history of ectopic pregnancy، ثاني جاب symptoms amenorrhea واشياء زي دي، you have to put this ectopic pregnancy again، لأنه البيشنت اللي عندهم prior past history of ectopic pregnancy more liable to develop again the ectopic pregnancy. And also if there is any tubal maneuver, injury or surgery, also this patient more liable to develop ectopic pregnancy. And if also there is مثلا tubal ligation or the pelvic inflammatory disease، يعني البيشنت عنده الريسك هنا pelvic inflammatory disease، لأنه بيحصل لنا دائما blockage. pelvic inflammatory disease complicated by blockage of the of the fallopian tubes، لذلك بيحصل لهم برضه هناك. أو in vitro fertilization، اللي هو بيحصل لهم بيعملوا لهم الان فيترو fertilization، بعدين بيعملوا لهم plantation الفيترا، ده اللي بيحصل لهم common ectopic pregnancy. طيب أول شيء إنه patient طبعا هو suspected، نحن بنعمل له طبعا laboratory HCG to measure ال quantitative HCG، نشوف الهرمونال هل في increase ال HCG positive or هو rising or not. ده بعدين نعمل التراساوند. التراساوند exam should be performed for any patient suspected ectopic pregnancy, especially transvaginal. يعني you can do both، لكن transvaginal is more sensitive. is the best initial imaging test for assessment or exclusion or ectopic pregnancy. طيب احنا عندنا ماني ساينس اوف ectopic pregnancy. طبعا اذا لقينا انه gestational sac outside of the uterine cavity معناته ان this definite this is ectopic pregnancy. يعني if you see gestational sac outside of the uterine cavity، مثلا this one، لاحظوا انه الجستيشنال ساك دي موجود in the tube، طبعا هنا ما جايب لك الجزء من اليوترس، لكن يعني وعاملين ايمج شنو للفالوبيان تيوب بس. فذيس gestational sac ما موجودة in the uterine cavity. So this is this is a strong sign of ectopic pregnancy, presence of gestational sac outside of the uterine cavity. دي بنعرف definitely إنه this is شنو ectopic pregnancy، لأنه normal should be in the uterine cavity. طيب يلا عندنا other symptoms. أول شيء نلقى empty uterine cavity with thicker endometrial lining. يعني نلقى endometrial بيبقى thicker واليوترس cavity empty. أحيانا بنلقى شنو free fluid in the pouch of Douglas اللي هي recto-uterine space called the sac or pouch of Douglas. لكن this is طبعا non specific sign، لأنه احنا عارفين إنه this area may be يعني في الأسايتس أو في ذات normal fluid could be seen in this area. يعني after cycle و after pregnancy يعني you can find this fluid in this area normally. لكن it is commonly associated with ectopic pregnancy, although it is not a specific sign. لكن في الساين المهم إنه empty uterine cavity with thickened endometrial cavity. في others اللي هي يمكن نلقى شنو extra ovarian adnexia mass، نقرا complex mass in the adnexia and also tubal ring sign بنسميها الفلوب sign اللي هي بيكون عندنا ectogenic ring that surround the unruptured ectopic pregnancy اللي هي زي دي. ف this is trans vaginal ultrasound you can see the flop sign اللي قلنا ectogenic mass and this is the you can see the يعني الاوفريز والفري فلويد اللي هي فري بلاد واليوترس يوتراين وول. اهم شيء احنا الفلوب ساين دي هايبر ايكويد بتكون as a rounded mass هايبر ايكويد. طيب قلنا احنا اذا عملنا التراساوند برضه ممكن نلقى شنو الجستيشن الساك إذا بيشن هي بوزيتيف بريجنسي وعندها جاد أمونوريا وأبدومينال بين وفاجينال بليدنج، ولو عملنا ألترا ساوند لقينا إنه there is a gestational sac in the fallopian tubes or in the adnexia يعني and without any evidence of gestational sac in the uterus، فلذلك نفكر بقوة إنه this is a ectopic pregnancy. Ectopic pregnancy, absence of gestational sac in the uterine cavity with the gestational sac in the adnexal region or complex. أحيانا بنلقى complex، حتى ممكن ما نلقى gestational sac in the adnexal region، نلقى بس complex mass in the adnexal region. But this is also highly suspected of ectopic pregnancy. Very important this part. سألت عنه الهيداتيفور مولر بريجنسي اللي هو gestational trophoblastic disease. طبعا هو non cancerous lesion developing the uterus molar pregnancy. بيحصل fertilization of the ovum، لكن بعد ذاك بيحصل لها انه يعني instead of to be يعني continue as a pregnancy بيحصل developing the placenta، لكن بيحصل يعني the intrauterine pregnancy does not develop. والبلاسنتا بيحصل لها development with بيكون عندها with multiple cysts. طيب طبعا هي البيشنت اصلا احنا بنكون متوقع انها هي عندها امونوريا كانها هي pregnant، لما نجي نعمل you have to do ultrasound طبعا لانه هي سيف يعني، اذا you have to do ultrasound. طيب this hydatiform may be classified into two parts. عندنا partial and complete molar pregnancy. hydatiform or molar pregnancy. طيب in partial molar pregnancy ممكن تشوف الفيتال parts. fetal parts ممكن تشوف مثلا lower limbs upper limbs يعني could be seen. واحيانا تلقى الفيتال تونز الفيتال هارت يعني الفيبل، يعني تشوف الفيتال هارت by Doppler you can see the fetal heart and there is a amniotic fluid يعني كأنه pregnancy، لكن البلاسنتا بتكون bulk increase placental thickness. This is a partial molar pregnancy. You can see the fetal part يعني this is the مثلا head, this is the spine لكن the placenta is bulky with multiple cysts. يعني اللي هي الدير cystic lesion. فدي لاحظ الامينيتيك فلويد موجود. This is a partial molar pregnancy. طيب the other one is complete. In this one ما بنشوف fetal part. يكون اليوترس bulky بنلقى echogenic mass. يعني كأنه hyperechoic mass. This echogenic mass contain multiple cysts. زي ديت cyst ديت. لما نقول cyst معناتها حاجة hypoechoic or anechoic يعني سوداء circular structure anechoic cystic areas. حتى عند الساين كثيرة بيسموا بها هذا this appearance. لازم يسموها Swiss peas or honeycomb or snowstorm or bunch of the grapes. فمثلا in this one you can see كأن عندنا snowstorm كأن عندنا عاصفة ثلجية زي ما نقول snowstorm. This is hydatiform mole with demonstrated by this ultrasound transvaginal ultrasound you can see this patient طبعا present with amenorrhea كأنها هي pregnant لكن كان عندها شنو اللي هو عندها يعني ممكن تكون جات لي follow up انها هي pregnant لكن نجي نعمل ultrasound there is no fetal part and there is a cystic lesion the cystic mass with cystic lesion. فthis is cystic lesion with this characteristic appearance اللي هي بيسموها snowstorm pattern is highly suggestive of complete molar pregnancy. أهم شيء in complete molar pregnancy there is no fetal part and there is no amniotic fluid. زي البارشل amniotic fluid there is no. لاحظ إنه there is no amniotic fluid. In this one there is a fluid and there is a fetal part but in the complete there is no fetal part no amniotic fluid. أكيد طبعا هو ما في حتى fetal part عشان كده ما في هارد تون يعني ما في هارد beating يعني. والساينس قلنا نسميها شنو honeycomb bunch of grapes or snowstorm. حتى ترم غير استخدموا snowstorms appear. This is the last slide. If you have any question please feel free to ask.
لا يعطيك العافية دكتور.
طيب يعني
يعطيك العافية دكتور.
عافيكم بس on minute يعني please يعني يعني نتأكد انكم بس في بعض الاشياء عارفينها. please comment on this يعني what is the imaging يعني مثلا it is مثلا CT of what which part and what do you see.
ultrasound
ultrasound of what.
intrauterine contraceptive
Yes.
device.
Is it transabdominal or transvaginal ultrasound?
intrauterine contraceptive.
Yes, transvaginal ultrasound. What do you see? حتى ممكن describe يعني without يعني ما ضروري تقول final diagnosis. What do you see يعني حاجة شايفة غير abnormal. Describe the abnormality. طيب how to describe this in sonographic terms?
Hyperechoic.
Yes, there is the shape of this is
linear.
linear. صح. This is a linear hyperechoic structure. In which part of the uterus do you see this? احنا قلنا in the center في ايش؟ هنا دي المايوميتريوم and this is endometrial cavity. So what is this? What is this? يعني this is most likely what? Linear hyperechoic in the uterine cavity. What device do you see? What is the name of this device?
intrauterine tube.
Yes, this is intrauterine device, intrauterine contraceptive device. And you can see there is a free fluid here. This is a recto-uterine space. Recto-uterine space. What is this? What is this image technique?
CT.
CT. Which plane? Sagittal. Is it sagittal?
Axial.
Axial. What is this? Anatomy. What is this? Usually this is anterior. CT axial. Usually this is anterior and this is posterior.
Urinary bladder.
Urinary bladder.
And what is this?
Rectum.
Yes. And what is this?
Uterus.
Uterus. Is this uterus normal يعني? طبعا هو it is a diagnosis طبعا. Yes.
It is compressing the rectum.
Yes. And also the urinary bladder. So there is a lesion. طبعا هو يعني في الدياجنوز طبعا ما الان احنا جايبين سكشن واحده، لكن زي ما قلت لكم كم مره انه اتحاد you can follow this يعني يعني هتشوف كل السكشنز above and below this level، لذلك بتكون لك الحكايه اسهل يعني. لكن from one image usually there is a difficulty يعني، لكن اذا كان if you look to all scan from down to up you can easily detect the abnormality. This is the lesion or mass as the cervix, but this is a uterine carcinoma. What is this imaging technique?
MRI.
MRI. What do you see?
Enlarged uterus, compressing rectum and urinary bladder.
Yeah. What is the cause of compressing of the uterus and the urinary bladder? ليش حصل لهم compression? Why the uterus is enlarged?
Maybe a tumor.
Maybe tumor.
Where is the tumor? In which part of the uterus? يعني تكلمنا عن anatomy fundus, body, cervix, vagina. What is the? Where is the tumor?
The vagina.
The fundus.
Yes, the fundus here is the normal, like the lesion is here. Extending from this, يعني not in the vagina here, يعني vagina here, but this is in the cervix, in the lower part and the cervix. يعني here uterine cervical يعني in the body and the cervix. This is advanced carcinoma of the cervix in this axial XCT and coronal MRI. Thank you for your participation. Well done. Do you have any more questions? Do you need more explanation for any slide?
يعطيك العافية دكتور.
Thank you, doctor.
Thank you.
Thank you, doctor.